because the microbiota is so complex, there's really high individual variances. We have now pretty solid data or understanding on certain bacteria that may be associated with MS, but then we also have to keep in mind these bacteria always act in an ecosystem, so it's probably more complex than just saying this is a bad and this is a good guy. I do think personally that we still need to work more on mechanistic understanding of diseases, transferring, for example, stool samples from patient into mouse models where we can see the effects in order to really dissect the mechanisms, to have a solid understanding and basis to develop therapies. But of course, I think the way to use the microbiome to target the disease will be twofold. One is to remove more pro-inflammatory bacteria by certain measures. And the second way is to basically supplement bacteria that have a beneficial immune response. But I always tell my patients, it's not so easy, and they have to be somehow disappointed because it's really a challenge, because until the age of 2, our microbiome is still quite flexible, so it builds up. After the age of 2, it's quite stable. So to basically have a successfully and maintain change in the microbiome, we need to implement measures that perpetuatively basically remain that challenge of the microbiome that then translates into changes in the immune system. So I think this will be, in addition to finding which ones are bad or good, then to maintain the effect of the change of microbiome on the immune system will be a challenge. And for example, now, thinking about what has been done, there's this interesting data on fecal microbiota transplant, but data has also shown that this comes along with quite decent side effects. So there was data on transfer of resistant bacteria that then led to death of patients. So we always, of course, have to balance risk and benefit of everything we do for our patients. And MS is not a deadly disease. So we have a large collection of very well working DMTs. So we want to get even better and improve the disease and eventually stop the disease. But this always have to be balanced with the risk. So I really think coming with targeted bacteria as an intervention will be the way to go, rather than with more cruder measures such as DMT. And of course, in addition to changing the microbiota composition is diet, because diet is a way for us to also modulate microbiota composition. And this is something that can be maintained. And in that regard, I'm quite pleased to now see evolving work on that, and especially interesting work now recently publishing on intermittent fasting, having both a direct effect on microbiota, but also on immune system without going through microbiota. So I think there will be more work to really look at how we can change the microbiome or alter the immune system even directly with dietary changes, and how we can implement that. When I ask my patients what to do now, I always, I'm still quite conservative, and I say there are really two things we really know. One is vitamin D, right? Vitamin D deficiency puts you at risk to develop an MS and also to have a more severe course. So definitely we're always reaching at high vitamin D levels in our patients. This is something that can be easily done and is very well tolerated. And the second is that we know that Mediterranean diet has a positive effect on our immune system, but also on our cardiovascular system. So that's definitely the two things that, I think are set in stone that should be pursued. Everything else is more, I think, in a rather premature stage. There's also this interesting data on propionates, which could be supplemented, which may have a beneficial effect on immune cells. But I think that this needs to be consolidated a little bit more before we then move this really solidly into clinical practice.